And as we speak of women, we're also threading a conversation onto children welfare.
Yep.
And we're joined in studio, of course, by Carren Ageng'o. She is the Principal Secretary for Children Welfare. And we'll be discussing how to keep children safe. Welcome to studio, Carren.
Thank you.
It's so good to have you.
And I'm glad to, this is my first interview in the media.
You've warmed up the seat.
I have warmed up the seat and also the office of the PS for Children Welfare Services.
Indeed. I love the red on red.
You know,
nice.
Children love colors. And so as I think about my wardrobe, I should be thinking about child-friendly colors.
I like that.
Yeah.
Intentionality in your work.
Yes.
Well, it's a good one, PS. We'll discuss that. We'll also discuss the State Department and the mandate of the State Department and the work that has been done by various institutions in government to protect the welfare of children, but also the very many gaps that are there in our society. But the first thing I want you to do is Mariam is going to give us a quote from a fictitious character, but the quote is very relevant. It's not fictitious, right? And then let's hear whether it relates.
The character isn't fictitious. Fictional, yes.
It is a fictitious. Okay, fictional.
The quote is,
fictional.
Do or do not, there is no try. Do or do not, there is no try. It's by a fictional character, not a fictitious one, called Yoda from the Star Wars universe.
Yes.
And he was speaking as a mentor to someone, and he was telling them, you do or you do not, there is no try.
Yeah.
What does that mean to you?
For me, it means take action when you need to. Because if you fail to take action, a lot can happen and a lot of damage can happen.
Right. I like that. Take action. I think we often get lost in or we waste a lot of time in trying to figure things out, you know, the thinking, the decision making. And sometimes making the wrong decision is better than making no decision, right? So
Sure.
move, as opposed to thinking, should I go left, should I go right? Ata songa mbele.
Well, let me analyze first.
Yes, let me analyze.
Let me think it through.
Yes.
Yeah.
Maybe I should, before I act, maybe I should do something this and the other. Yeah, and so on and so forth.
And you see, as you delay to take the decision, some damage, especially issues of children, you find a child is suffering. And we say children issues cannot wait. A child's issue must be addressed immediately.
I agree. The Principal Secretary for Children Welfare, what does that docket entail exactly for those who are not familiar with it? And how long has it been in existence?
So the State Department for Children Welfare Services is a new department. It was created just slightly over a month ago by His Excellency, the President of this nation. Initially, this was a directorate under the Ministry of Social Labor, State Department of Social Protection. However, our President has seen that our children need more focus. And so this State Department was created on 17th of April this year, and I was appointed as the PS for Children Welfare Services, specifically to take care of children welfare. A lot, when I come to the mandate of the department, it involves social protection for children, the vulnerable children. In this country, we have quite a number of children who are orphans and vulnerable children, and one of the things that we have as a mandate is to ensure the vulnerable children are well taken care of in terms of their education and their well-being generally by supporting them even through education. Another thing that we do is to be responsive when it comes to children matters. We do have children who are exposed to danger. And so as a State Department, we are expected to respond immediately when an issue is raised on a child that is in danger. A child can be in danger from the family or outside the family. A child can be attacked when they are on the way to school. A child can be attacked anywhere. And so we need to also act immediately to protect these children. As a State Department, we also do have a mandate to ensure our children's health are well taken care of. So we do have nutrition for children, especially the children that are under 36 months, because this is a critical age where children require a lot of support, especially those who cannot afford nutrition. So we have malnutrition in some parts of this nation that prevent even children from growth, and therefore that is also the work of the State Department that we do. We have oncoming issues that are coming up, like online child protection. Because of digitization and access to internet, our children are getting exposed. And so as part of the State Department's mandate, we ensure that our children are also protected online through various forums and sensitization, that they should be aware that there are people out there who can actually expose them to danger as they use the internet. So the mandate is quite huge. We are actually awaiting the president's directive, what we call an executive order, which should be out very soon, where the president will be clarifying the full mandate of the State Department. However, those that I've mentioned are the mandate that have been there in before as a directorate, and this directorate has now been expanded to a State Department.
Okay.
There's a day when we hosted a whole conversation about children in April this year, actually April 23rd, and we had senior people from the Directorate of Children's Services and from the National Council for Children's Services. Okay. Now, that was before the creation of the State Department. What would it mean? How different would it be when we had these institutions as directorates and the Council for Children's Services, and now elevating it to a State Department? Apart from having a PS, what else?
So National Council for Children's Services is actually a state corporation which is under the State Department for Children Welfare Services. It is an institution, one of the SAGA's institution under my docket. And the role of the National Council for Children's Services is regulatory, is to regulate activities of children in this nation. We do have institutions that are taking care of our children. We call them the charitable children institutions. So one of the mandate of the National Council for Children's Services is to ensure standards within these institutions are met, because when children live in conditions that are not standardized, then we would tend to have institutions that will harm children, have homes that are not conducive to children. So the National Council for Children is actually a saga which is under my state docket.
Okay. So apart from having a PS now, why do we need to make this a State Department?
One of the things that is important in creating a State Department is that you give visibility and authority and mandate over a certain issue. For example, now this is the only institution that will be dealing with only children matters. You note that in Kenya we have various state departments. There are more than 58. And you have State Department of Education, just basic education, dealing with education in that docket. We have State Department for Medical Services dealing with medical issues. We do have State Department for Housing and Urban. So each State Department is created so that it can take care of implementation of government programs in a specific docket. So for this one, it was important that children are given that State Department so that their welfare is taken care of. We have noted that in this country, we have over 46% of our population are children. Now you understand why this State Department is very important. Our population of 46%, translating to about 21.9 million Kenyans. These are children that, according to 2019 census, are actually in this nation. It is expected that this figure has now improved, and as we will be taking the next census, you'll be seeing that children are now tending towards 50% of Kenyan population. And therefore, this is really critical, and that's why His Excellency felt that we need to have this State Department specifically to deal with children matters.
Right. Before we get into keeping children safe, everywhere online included, I want to talk about street children and where they fall as far as, who takes care of the welfare of street children?
Currently, we do have an institution within the Ministry of Labor and Social Protection, and it is called the Street Families Rehabilitation Trust Fund. The government provides funding for management of street families within that institution, and that this is the institution that is in charge. They support these street children, and sometimes you may find even this institution goes all the way in the evening to provide, to confirm the families in the street children. There's a lot that happens. Mainly, we try to remove people from the street to put them in safe families. That is the immediate action that we try to do, and that institution is actually has the mandate to do that. So there are programs which are designed for street families. However, the challenge is that you find that when street families are removed from the street, they tend to go back. Right. And so this is really a challenge that the department is dealing with. And currently, I can confirm that the mandate of the street families has not been fully clarified, and that is why I said we are waiting for the executive order by His Excellency, so that then we can deal with street families. But however, there's an institution under the Ministry of Labor and Social Protection, which is currently dealing with street families, and there are various programs handling street families.
This has been an issue for a long time, PS. The issue of street families, street children, and then they end up there with relatives and so on and so forth. Some even start families while in the streets, right? We've seen various governments trying measures here, start, stop, and they don't seem to bear fruit.
Right.
What do you think is a solution that's needed, even if it's just not a policy solution that would be required to address the issue of homelessness, and especially when it comes to children?
So one of the action that the government has taken is we do have a national plan of action on alternative family care, where we are trying to trace families of these people, and the street families are not left behind, because what is coming out is that over 90% of the people you see out here, they have some form of family relationship that they can go back with. And again, some street families, some children are also being trafficked from outside Kenya. We may not call it trafficking because, let's say in East Africa, we have free movement of persons, and you cannot prevent somebody moving, let's say, from our neighboring countries to Kenya because of that free movement of persons. Yeah. So you find some children are being moved from outside Kenya, and you may find them like in the streets with, trying to beg, and some people are using this for business. So what is happening is that we are dealing with this program by first understanding what is causing this, and then moving them. And so there's already a plan of action which is in place, and this is what we are riding on. It is a plan of action which is supposed to run up to 2032 to deal with alternative family care, tracing the families of these people and taking them back to their homes, and then we can support them from wherever they are, because you find sometimes these are caused by economic hardships. So the government has also come up with a social protection bill. Currently, it's a social protection bill 2025, which will very soon be signed into law. And one of the provisions of that social protection bill is to ensure that families with economic hardship will be supported with some form of funding from the government. And that will deal with people who are coming to the streets to beg and look for money. And also we do have training programs to give them skills that they can use to, make at least something for their basic needs to avoid them from coming to the streets. So this is a plan of action that will run all the way to 2032.
Right.
Yeah.
When we had someone from the directorate as well speaking on the same, the pushback was a lot of the times people are there because even when they do have family, those families don't want them for one reason or the other. Sometimes it is economic, like you've spoken to, but sometimes it's just what to do our Turkey. And then with the closure of now children's homes, it's like, okay, what do we do really to take care of these children who may have family, but not family that is good family or that wants them there? That now becomes the question.
Actually, the issue of closing these children institutions is not factual.
Oh.
We are actually not closing the children homes, as you call them. We call them charitable children institutions. What we are doing is to encourage the children institutions that are already there to try and move these children to their families. And this is a global matter. It's not a Kenyan issue. Children globally have actually voiced their concern that if they live in these children institutions, their growth and development is really affected. Affected in the form of, you find a child would be in a children institution, but a child cannot even talk. You know, psychologically, some children go through a lot. And it has been found out through research that children who grow up in a family thrive. Children who grow up in a family will grow have a positive growth. Psychologically, children who grow up in families will do much better than children who live in the institutions. And this is what formed the global decision, which Kenya has also signed, that we need to move the children away from the institutions back to some form of family. For example, a child may not have parents, but a child have relatives. Probably this child came to a children institutions because they lost their parents, but they have an uncle, they have an auntie. So what we are encouraging families, and we are coming up with a parenting program, which is already piloted, and saying that let parents come and take these children. Let's appreciate our brothers and sisters. Probably they have died, but they have left children. Let's take care of these children instead of sending these children to the children's home, which in future will affect them. Another thing that children will have problem with.
I was speaking more to the idea that sometimes the care that's at home may not necessarily be better than the one in the institution. And I do understand that ideally, before a child goes to a children's home, there should be relatives, someone, you know, able to take care of them.
Yeah.
But sometimes that's not the case. Someone may be there, but they're not able, or they're not willing, or they're not,
So that is why we have a support program for such people, because most of the reasons that are coming up for pushing the children to the homes are economic hardships. So what we are saying, currently we have a program for supporting families who are taking care of orphans and vulnerable children. Around more than 400,000 families are currently benefiting under Inua Jamii program. So they are given some token, the same way we are supporting the older persons to take care of these vulnerable children within their families. But not to say that we will close these children homes completely. We have up to 2032, and this is a matter that we'll be evaluating. If we find that by then it will not be possible to do this, then we will be able to evaluate our policy and come up with alternatives. But what we are saying is that the children homes will still be there to support the program of children within families outside there. For example, the children can come there as in form of a school. They can also use these centers for training or upskilling their relatives. And we do have several NGOs in this country that are supporting these children in this home. So what we are telling them, even as a government, as we support these families through the fund that I talked about, our institutions, the NGO sector, which are also key in this issue of children, let them support the children in those families. If it is you want to support them with food, instead of putting them together, support them through that
Support the family unit.
Support the family unit, because again, it has also been researched that supporting the children outside the children's home is cheaper than having the children within the institution.
I cannot argue much with what that research would be. and what it would be saying, because anecdotally, if you just think about it logically, it would be much better if a child is growing up within a home with other relatives and people who, you know, these are my people.
Yes.
So they have an identity as they are growing.
Exactly,
And
the identity is the issue.
Problem, though, is when we say that a majority of them are out of these homes because of economic hardship, right? And we are not talking about the children of this home. The children of this mother and father, or this father or this mother, are out of home because of economic hardship. It would be the children of this homestead. Maybe they are orphaned children who ended up in this home, and they're the ones who've left the home. So there's the issue of the care in the first instance of the adults in this home, and the care they were giving their own children versus the care they were giving to this other child. So they may treat this child as a business, as a source of an income. And that was a question. One, the moment you do not then send the money as government, then you tell this child, wewe fanya hivi, rudi kwa ile nyumba ulitoka.
Yeah.
Because that's what they did in the first place. That's how that child ended up in that home.
We do have institutions that mean well for children.
True.
And currently we have 902 institutions which are taking care of our children in the institutions. And we also do
Sorry,
have...
Madam Pierce, can I interrupt you just a bit so we can get a caller? He doesn't drop, and then we'll get back to you answering. I'm so sorry to interrupt.
Okay.
We have Paul from Nakuru who's calling in. Anataka kuchangia kidogo. Do you have a question or a comment for the PS, Paul?
Paul, a quick one. Remember him? Hello?
Yes. Paul, go ahead.
Agent Provocateur, I want to find out how come they are in the ground, because we have a lot of different and also what is their contribution to sustaining some legitimate children home in Nakuru and other places. And maybe the last one, a comment, I felt very nice when it comes to attention of their presence, the creation of children. I think it's like me. When they,
Paul, we have an issue with your line, Paul.
It clearly.
Can't get it clear. Maybe we try and call you back, Paul, and then we get you on air with the PS, so you can respond to that question.
Yeah, or alternatively, you can also WhatsApp us 0112 500 400, and then we'll get a response from the PS for sure. But sorry to interrupt you. Continue answering.
Yeah. So he talked of some people using children for economic gain. I think that's what I got in terms of establishing an institution, or even maybe part of the family expecting that I have this child because of economic gain.
Yes.
But I want to say that we have institutions that mean well for children. And currently we have 902 institutions. They are called charitable children institutions that are taking care of 44,000 children in Kenya. So these are the children that currently we are saying are in institutions. Out of a population of 21.9 million children in Kenya, 44,000 are living in the children institutions. And what we do have is a regulation to ensure these institutions do not take advantage of children.
Let me just interrupt you. My concern was not with the institutions. My concern was with reconnecting them with the families.
Back to the families.
The families that they ran away from to go to the streets or to end up in these CCIs.
Yeah.
Now we are saying that let's take them back to reintegrate them with the family.
Yes.
Are we addressing the root cause? The root cause cannot only be economic. Economic concerns may be big.
And parental negligence is a major issue.
So
I will take you through just statistics on. We have a system called Child Protection Information Management System, and in this system we do have reporting of cases through a line. We have a line 116. It's a toll-free line, and what is happening is that people are reporting parental negligence as a major cause. actually the major cause is families. So what our organization does, we have children officers all the way to the sub-county level. And one of the things that they do is counseling these families. We have programs. We have training parents, like a solution which has been found on dealing with neglect for families is coming up, talking to these families to agree. So even sometimes we make a joint agreement between the parents and in the best interest of the child.
Yeah.
And this process involves a lot of talking. These people come, sit with our children officers, have a discussion. What was the issue? Sometimes you find a child is running from home because they feel unsafe. They feel the parents are hostile.
Yep.
So what will happen is that our children officers will find a way. A child can report through this line, 116. But we find a way of dealing with the parents first, even without telling them that your child reported you to be, violent against them or something. You find a way of talking to
abusive.
them to an extent that the time now they're in agreement to accept back this child, they have also learned a lesson, how to manage children at home. So we have a parenting program where parents are being trained how to take care of these children, and that is one of the things that we are upscaling to in preparation for this alternative family care, so that the parents will be ready and other families to take care of
It's
these
attacking
children.
from all ends.
Yeah.
We have a caller called Kiprono from Kericho. Good morning, Kiprono.
Good morning to you.
What is your question or comment for Madam PS?
My name is Kiprono, a children officer from Bureti sub-county. And I wanted to congratulate the kind of work our PS is doing in matters children welfare. Yeah, we want to thank the government for being supportive and also to encourage all when we talk about institutional placement versus family placement.
Yes.
At the grassroots level, you'll find that family placement is more effective on ground, especially when we want to build the identity or also to bond the relatives and to bring together these disadvantaged children to their relatives. They'll be more taken care of than being at an institution whereby when it comes to matters culture, there are people. When children are placed in other institutions, they tend to have a culture vary. And then while when you take them to their families, they are well taken care of, and also they get to learn more about their culture.
Thank you, Kiprono. Before I let you go, I just wanted to know perhaps what your day looks like, because I think it's good to also now get the perspective
From
of
the
our
horse's mouth.
from the horse's mouth.
Yeah.
As a children officer, what are you doing on Leo? What's on your agenda for today?
My agenda for today, when I first report to the office, there are those matters that are first report that are previously been taken on record that they should be addressed today. There is a record book that we usually keep children's record, and also there are follow-up matters.
So you can see on the ground, this is one of our staff, and actually I haven't met him, but what I do assess, if I go to a place, like one day I was in somewhere in Suba, and I asked, people brought up issues of orphans and vulnerable children, and I asked them, do you know the children's officer here? And they confirmed. And this is one of our officers who's calling from Buretia. And I've visited Eldoret, I have visited Kisumu, and I've visited a few parts of in this country just for the 1 month I've been in office. And what my assessment is that the work of our children officer is really great, and it is working up to the sub-county level. When you have a case on a child, the first person you should visit is the children officer in the sub-county. And we are working in collaboration with our National Government Administration Office, the NGAO, because these people understand, the chief, they are the ones who are close to these families, and any matter can be reported. They'll escalate to a children officer, and if it is, if they don't deal with it, then it will come to us. But the children officer can easily handle a case, and every single case they must do a report. Yesterday I was going through some report of cases which happened in Baringo, not children who are exposed to danger in Baringo, and the officer shared with us. We have a communication channel where I'm able to see what action did they take, and the immediate action that our officers take is to look at the best interests of the child and see where to place. If the child is exposed in danger at the family level, we have rescue centers. They'll identify immediate rescue center to go and take this child as the matter is being handled.
You mentioned rescue centers. We have a very progressive law, the Children's Act, that was passed the other day, and it provides for the establishment of rescue centers in all counties.
Yeah.
Do we have rescue centers in all 49 counties?
Currently, we do have rescue centers, not in all counties. Actually, the Children's Act has been in place since 2022, and not the other day. We are talking of 3 years, and I came into office, and one of the things that we have assessed, are we implementing the Children's Act as it should be in order to protect our children? And it requires us to establish policies and regulations. And last month, we were doing public participation on 7 regulations that we have developed to be able to help us in managing and implementing this act. And as you come to the issue of rescue centers, I have visited, for example, I visited Eldoret. I found the county has established a rescue center, which I visited, rescuing young girls who are also the mothers to these children, and also children, an institution that is good. We do have rescue centers which are run by the government, and also rescue centers which are private. But for the counties, we also have Kisumu. We also have in Kisumu a rescue center. But this rescue center is run by the national government, by our office. So I'm having conversations with county governments. For example, 2 days ago, I had a conversation with the deputy governor on my way as I was traveling and finding out whether West Pokot has a rescue center. And he confirmed that they do not have. And I told him it is a priority and it is a matter that we are going to discuss. So we do have some counties that have rescue centers. This next week we are celebrating the Day of the African Child. We launched it this Monday in Bungoma, and on 16th is the very day. We are having this function in Makueni County. The reason why we have selected Makueni County is Makueni County has established a rescue center. We're looking at the standards that we have put in place. We do guide them that for you to put up a rescue center, you must follow these standards. So Makueni County is a model county that has established a rescue center that we will be launching soon. But I can confirm that counties are also on board when it comes to children matters, and a majority of them are coming up also with children policies, so that they also take into consideration that the children are their children within the county, and it is in line with the Children's Act.
You see, a child that ends up in a rescue center is a child in distress.
Exactly.
Right? So very often we will find that it's members of a community that establish that this child needs to be rescued from the environment they're in, most likely a home that they're in. So once they're rescued from that home and taken through the system into a rescue center, what happens to that child in the rescue center? Are they going there to get support only for a maximum of 6 months, a year? Is that their new permanent home? Are we seeking to now remove them from the family that was, causing them the distress? What's the purpose of a rescue center?
If you look at the Children's Act, separation of a child from the family should be short-term. Therefore, rescue centers, we are talking of actually a maximum of 6 months. As you say, the issue of putting a child in a rescue center is a temporary measure. Temporary measure as we deal with the issue. For example, if a child is going through harmful practice and we find the child is endangered,
Right.
we will ensure the child is taken to hospital, and then the child has a safe place. So the rescue centers are mainly acting as safe places, temporary safe places, as we look for a permanent solution. So you will find that the numbers in the rescue centers, you can go today, you find you have 1,000, or actually most of them have like 100, not so many.
Yeah.
The following day you find you have 80, because we have already taken back these children to somewhere that is safe. So it's a temporary measure, and we don't expect that rescue centers will be permanent homes to these children.
Right. I have a question around when the community is working against you in a sense, but before we get into that, I'm told we have a caller on the line. Phil, what's the name of the caller? Phil? All right. Before we get onto the caller, there's certain situations where community doesn't seem to be protecting the children. For example, there was a young woman, I will get her name so that I say it correctly, who was killed in Garissa for just walking out of a child marriage, right? Then there's situations where communities will protect pedophiles and abusers in general. How does then, this State Department now come in to protect those children? And I know there's a couple of people who are asking about the same on YouTube. Someone asking, providing the support we need is important. Child trauma, defilement, and early marriages are on the rise in pastoral communities, for example. Someone else was talking about cases of sodomy that are swept under the rug when people give a bribe, things like those. But the caller is ready now. Let's hear from them. What's their name, Phil? All right. Meba. Muitha.
Yes.
I am from Huruma. Good morning, Muitha.
Good morning to you.
All right.
Because the topic is about welfare of the children, okay? Kuuliza madam, kwa sababu kuna sheria ilikuwa imetolewa kwamba ikiwa mzazi amenigilete mtoto, hiyo mzazi anashikwa, alafu mtoto anachukuliwa na anashughulikiwa na serikali. Je, nataka niulize madam, ni kesi huyu mtoto ameshughulikiwa na serikali na mzazi ameshikwa kwa jela, utafanyaje mtoto atakapokuwa mkubwa? Mtafanyaje muunganishe uhusiano wake na mzazi ili warudiane?
Alifanywa nini na mzazi kabla aende jela, just to be sure?
Okay, alinigilete mtoto, alinigilete majukumu.
Ali?
Neglect.
Okay.
Neglect, yeah.
Okay. Sawa. Aya.
So mzazi
Let's say a child has been neglected by a parent, rescued, and let's even go into an area where by the time
the parent has been imprisoned or something like that.
If the parent is in prison, then there's a criminal element here. So let's use the case of defilement.
Yeah. So, but
or abuse,
not abused by parents.
Yeah.
The Children's Act is very clear. Any defilement, whether it is in the family, and again, most of the cases that are happening to children, especially when it comes to sexual violence, are the people they know. So if it may be a person living in that family, may not be the parents, but if defilement happens, then the matter will be taken seriously. The person is supposed to be charged in court.
Right.
And this is a person that cannot be left. There's a 5-year imprisonment.
Agreed.
But the most important thing would be first to rescue the child. But the offender will not go unchecked. Yeah. The offender will be charged in court. So we have all cases in court involve a children officer who will do a report. The magistrate looks at the report of the children officer, and the children officer visits all the way to the family, talks to neighbors, talks to people around this family to find out what really happened, even to get like witnesses outside this family.
That's in the case of like a criminal element, which I think he was speaking to. He did say, Kamamtome, if you've been imprisoned, then obviously there's a criminal element there. But there's a question around reconciliation where it was a case of neglect or, I think neglect is probably the better word. Is there room for reconciliation, and is there a way to facilitate that when there is no criminal element?
Even when there's criminal element, the reason why you're taking somebody to court, to jail, is rehabilitation. So at the end of a term of rehabilitation, and then you establish that this person has rehabilitated, you see there's a whole issue of reintegration to the community.
To the community, but okay.
There is a child.
We will be looking at...
Is there room and element for bringing this child and their offender together at some point?
I think
the offender is a parent.
Any decision we make on a child should be in the best interest of the child. And if this is a person who has defiled, which is really a serious matter on the child, the safety of the child will come first. We will assess. We'll assess whether by the time this parent is coming back home after imprisonment, is it really is it safe for this child to live in this family? So the best interest of the child will be considered. But cases of neglect are easy to deal with. These are cases where our officers sit down with the parents and talk to them. And for example, we have neglect even in form of cases in court for child maintenance. Actually, it forms the highest case of neglect. When I looked at cases reported, the highest was child custody and child maintenance. This is parents not accepting to take care of their children. So what we do is to have a parental agreement. A parental agreement can be signed. We have a secretary in charge of children. He authorizes the officer, even the children officer, like the one who was talking from Bureti, to sign, sit down with those two parents. They agree that they are going to take care of this child, and then the family will be reunited, and they should be assisted to live in peace through counseling and other programs that will allow them to know that it is important to take care of the children. And we have resolved 90% of cases of neglect through reconciliation and joint agreement, joint parental agreement.
Okay.
Yeah.
It just requires a third party to bring people together.
Yes, yes.
There's a question of those in foster care and the way our foster system is set up, not foster, but adoption especially, how rigorous it is, how tedious and bureaucratic it can be. Then even after that, for example, things like enrolling onto SHA, there's a lot of red tape that makes it hard to sometimes be a good person. You want to adopt a child, you want to take care of them, you want to give them health care, but it just becomes very tedious, very bureaucratic. Is there anything being done to make these processes more seamless and easier?
Yeah, I know I have received issues of challenges on adoption in this country, because adoption is a process where we are releasing a child to somebody who is their parents, and this is a permanent home for them in the future, and identity of the child in that new family. And adoption requires a careful process, because remember, you are taking this child to another family and they will have this family permanently as theirs. So there's a process of vetting. Any person who wants to do adoption must be vetted to ensure this child is going to live in a safe family. So it may take a process. Vetting means even the children officer will work with this person who wants to adopt. Visit their home regularly. Find out if maybe they are working else somewhere. The children officer will go to confirm.
Can single people adopt in Kenya? Sorry to interrupt your train of thought.
People who are not married.
Yes,
we have facilitated people who are not married, and I'm sure some of them, if they are listening, they can call anonymously, because sometimes maybe people may not want, because their neighbor did not know that they did an adoption. So they can call to confirm that, yes, we do have people who are not married are facilitated, of course, with the children of the same gender. They are facilitated to adopt children. Adoption is a process. What we have done as a State Department, I told you we have developed regulations, and one of the regulations is a regulation on child adoption. And we subjected this to public participation 2 weeks ago and last month. And we are receiving feedback, also for written feedback from various parties. And with this, we are going to come up with a formal policy and regulations that will guide step by step. Regulations clarify step by step. If you want to adopt, what do? You come here, look for this child. Most of the children that are being adopted are children who have been abandoned. by some families. So they're in a rescue place. They're in a center for babies, young babies that are being taken care of, as we look for alternative process of adopting. And it requires a lot of things, even matching. You know, you must kind of make this child to be almost similar to the person who wants to adopt. So for example, if they say the person is very light, and then we have a child of dark skin, people will start doubting, huyu aliba mtoto. No, they start saying that you stole a child.
Yep.
So there's a process, and it takes quite some time. So sometimes the person who wants to adopt feel the process is taking long because they need the child immediately.
Right.
But you have to consider all factors and agree that the best interest of this child will be by the time they're adopting this child. And one thing about adoption is that we do not allow foreigners to adopt any child from Kenya. We've already put up a moratorium.
Moratorium.
Yes, that no foreigner should adopt a child from Kenya, because this was an avenue for child trafficking, and we have stopped it. So only local people can adopt, unless if you are living outside the country and you have a relative. So we must establish that you have a
connection to Kenya, a solid
then
one.
you can adopt a child outside the country.
I like that. Thank you so much, Madam PS, for the work that you're doing, for making time for us this morning. We have to end the interview there, but I think this is a continuous conversation. We had Esther from the Directorate, now we're in a State Department, and I will say that I really like that the message is uniform. What she said, what you said, entirely the same.
We are working as a
yes,
team.
You're working as a team.
Yes.
There's something streamlined, and there's a
They've
policy.
done a good job of induction.
Wow, thank you very much. And just before I leave, we are talking of protecting our children online, and one of the things that I've launched since I came to office is this guided
In your
book.
1 month?
Yes, within 1 month,
Yes.
I have a lot of stuff that I can say I have achieved, and one of them is this Safe Online. It's a book to guide children. I would like to leave you with a copy, online copy. We are going to distribute it to all schools. Subject to resources that are available. We have our partners that are working with us. We are going to make enough copies, and we will be distributing them to schools, so that children can know how do they protect themselves online.
Thank you.
Beautiful.
And I think it's a great conversation to have. We'll talk about online child safety, because it requires an hour and 2 hours and 3 hours.
Yeah.
But thank you so much.
Oh, you're most welcome.
We have to love you and leave you, but of course we'll be back here. Not here. We will be back on ground tomorrow for another edition of Fixing the Nation on NTV, on Nation FM, on YouTube, on Instagram, on TikTok, anywhere with an internet signal. Of course, Latif, I know we're going over to a live before we even go into
Speaking
your world.
of YouTube, we'll be streaming. So the CS for Interior National Administration, Kipchumba Murkomen, is set to appear before the Senate plenary today at 10 a.m. to address the circumstances surrounding the death of Albert Ojwang while in custody at Central Police Station. Yes, so he was summoned by the Senate yesterday. He's saying he's going to honor that summons. So he'll be appearing before the Senate. Kipchumba Murkomen will be before the Senate at 10 a.m. You can follow that on our YouTube live stream. On TV, we'll also be showing another event that will be taking place. So we don't have our world today. We are going to have another event that we'll be broadcasting. But if you want to follow Kipchumba's submissions before the Senate, it will be live on NTV Kenya YouTube page. So have a lovely day, people. See you again tomorrow from the ground in Nakuru. Tomorrow on Friday, we'll be there, and we'll be hoping to engage with our fixers in Nakuru County. Goodbye.